Anaphylaxis is a serious allergic reaction that is rapid in onset and may cause death. It typically causes more than one of the following: an itchy rash, throat or tongue swelling, shortness of breath, vomiting, lightheadedness, low blood pressure. These symptoms typically come on over minutes to hours. Common causes include insect bites and stings, foods, and medications. Other causes include latex exposure and exercise. Cases may also occur without an obvious reason. The mechanism involves the release of mediators from certain types of white blood cells triggered by either immunologic or non-immunologic mechanisms. Diagnosis is based on the presenting symptoms and signs after exposure to a potential allergen. The primary treatment of anaphylaxis is epinephrine injection into a muscle, intravenous fluids, and positioning the person flat. Additional doses of epinephrine may be required. Other measures, such as antihistamines and steroids, are complementary. Carrying an epinephrine autoinjector and identification regarding the condition is recommended in people with a history of anaphylaxis. Worldwide, 0.05 to 2% of the population is estimated to experience anaphylaxis at some point in life. Rates appear to be increasing. It occurs most often in young people and females. Of people who go to a hospital with anaphylaxis in the United States, about 99.7% survive. The term comes from the ancient Greek ana, romanized, ana, lit, against, and the ancient Greek phylaxis, romanized, phylaxis, lit, protection. Anaphylaxis typically presents many different symptoms over minutes or hours with an average onset of 5 to 30 minutes if exposure is intravenous and 2 hours if from eating food. The most common areas affected include skin, heart and vasculature, and central nervous system, with usually 2 or more being involved. Symptoms typically include generalized hives, itchiness, flushing, or swelling of the afflicted tissues. Those with angioedema may describe a burning sensation of the skin rather than itchiness. Swelling of the tongue or throat occurs in up to about 20% of cases. Other features may include a runny nose and swelling of the conjunctiva. The skin may also be blue-tinged because of lack of oxygen. Respiratory symptoms and signs that may be present include shortness of breath, wheezes, or stridor. The wheezing is typically caused by spasms of the bronchial muscles, while stridor is related to upper airway obstruction secondary to swelling. Hoarseness, pain with swallowing, or a cough may also occur, while a fast heart rate caused by low blood pressure is more common. A Bezol-Jarisch reflex has been described in 10% of people, where a slow heart rate is associated with low blood pressure. A drop in blood pressure or shock may cause the feeling of lightheadedness or loss of consciousness. Really very low blood pressure may be the only sign of anaphylaxis. Coronary artery spasm may occur with subsequent myocardial infarction, dysrhythmia, or cardiac arrest. Those with underlying coronary disease are at greater risk of cardiac effects from anaphylaxis. The coronary spasm is related to the presence of histamine-releasing cells in the heart. Gastrointestinal symptoms may include crampy abdominal pain, diarrhea, and vomiting. There may be confusion, a loss of bladder control, or pelvic pain similar to that of uterine cramps. Dilation of blood vessels around the brain may cause headaches. A feeling of anxiety or of impending doom has also been described. Anaphylaxis can occur in response to almost any foreign substance. Common triggers include venom from insect bites or stings, foods, and medication. Foods are the most common trigger in children and young adults, while medications and insect bites and stings are more common in older adults. Less common causes include physical factors, biological agents such as semen, latex, hormonal changes, food additives such as monosodium glutamate and food colors, and topical medications. Physical factors such as exercise are recognized as a cause for anaphylaxis, and HPV may cause anaphylaxis as well. Many foods can trigger anaphylaxis. This may occur upon the first known ingestion. Common triggering foods vary around the world. In Western cultures, ingestion of or exposure to peanuts, wheat, nuts, certain types of seafood like shellfish, milk, and eggs are the most prevalent causes. Sesame is common in the Middle East, while rice and chickpeas are frequently encountered as sources of anaphylaxis in Asia. Severe cases are usually caused by ingesting the allergen, but some people experience a severe reaction upon contact. Children can outgrow their allergies. By age 16, 80% of children with anaphylaxis to milk or eggs and 20% who experience isolated anaphylaxis to peanuts can tolerate these foods. Any medication may potentially trigger anaphylaxis. The most common are beta-lactam antibiotics followed by aspirin and NSAIDs. Other antibiotics are implicated less frequently.